1. CDC ends emergency bird flu response as H5N1 cases decline in U.S. 2. CDC ends emergency response to H5N1 bird flu, what you need to know. 3. CDC ends emergency response to H5N1 bird flu in 2025, what you need to know. 4. U.S. bird flu emergency response ends as infections decline. 1. CDC ends emergency bird flu response as H5N1 cases decline in U.S. The U.S. Centers for Disease Control and Prevention, CDC, has officially ended its emergency measures for H5N1 bird flu, marking a significant shift in its approach to the virus. This decision was made after a noticeable decline in animal infections and the absence of human cases since February 2025. The CDC announced the deactivation of the emergency response on July 2, stating that ongoing surveillance and response efforts will continue under its influenza division. This move comes as the agency integrates bird flu updates with routine seasonal influenza data, a change that has been highlighted in its official website. The CDC now plans to report monthly figures on the number of people tested for bird flu, though it will cease publishing animal infection rates on its platform. Over the past year, the virus has infected 70 individuals, predominantly farm workers, with 1 fatality reported. Experts caution that further spread of the virus could increase its transmissibility to humans, urging vigilance amid ongoing agricultural and poultry operations. The CDC's public health strategy has faced challenges this year, including staffing shortages at the Department of Agriculture, which were partly attributed to the Trump administration's broader effort to reduce federal workforce size. A $700 million contract with Moderna, a biotech company, was cancelled, raising concerns about the agency's ability to maintain critical research and development for bird flu vaccines. While the CDC's decision to phase out the emergency response has been widely welcomed as a step toward reducing unnecessary interventions, it has sparked debate. Some argue that the virus's potential to mutate and spread to humans remains a pressing concern, while others believe the decline in infections signals a more stable public health landscape. As the CDC continues to monitor the situation, the balance between proactive measures and practical resource allocation remains a central topic of discussion. This transition underscores the dynamic nature of public health responses, where rapid decisions must align with evolving scientific understanding and logistical realities. Whether this shift reflects a strategic recalibration or a temporary easing of caution, the broader implications for global bird flu prevention remain a subject of ongoing analysis. 2. CDC ends emergency response to H5N1 bird flu, what you need to know. When danger seems to fade, is it truly safe, or are we just lowering our guard? That's the question at the heart of the CDC's latest decision, which has stirred quiet debate among health experts. The U.S. Centers for Disease Control and Prevention, CDC, has officially ended its emergency response to the H5N1 bird flu, attributing the move to a steady decline in reported cases. According to an announcement released by the Department of Health and Human Services, this shift comes after months without any new human cases of H5N1 since February 2025. So, as of July 2, 2025, the CDC transitioned away from emergency status, resuming standard operations and integrating ongoing monitoring and outbreak readiness into its regular influenza division. The agency emphasized that vigilance isn't ending, surveillance, preparedness, and response efforts for the H5N1 strain will still continue as part of broader influenza management. But here's where it gets controversial. Some people worry that stepping back from emergency mode could lead to complacency, especially with a virus that's shown it can surprise us. Dr. Nirav Shah, who recently resigned as CDC's principal deputy director and has since taken up a teaching post at Colby College in Maine, made a point to clarify that this decision wasn't imposed by leadership alone. Career scientists at the CDC reviewed the situation thoroughly and decided there was no longer a need to continue emergency-level activity, he explained. Shah added, with no new human cases, there's no justification for maintaining crisis mode 24/7. Still, if the situation changes, ramping up the response is simple and can be done within a single afternoon. And this is the part most people miss. Emergency declarations are not permanent, they're tools that should flex with the threat level. But is ending them too soon playing with fire? Let's talk context. H5N1 was first identified in the late 1990s and has periodically caused outbreaks around the world. Since 2022, nearly 175 million birds in the US alone, from wild populations to backyard chickens, have been affected. Even more concerning, the virus has crossed species barriers, impacting dozens of mammal species in more than 100 countries. In 2024, H5N1 took an alarming turn by infecting US dairy cattle, threatening both animal health and the dairy industry. Over the past 14 months, infections have appeared in over 1,000 herds across 17 states. On the human side, the numbers are far lower. The US has seen a total of 70 documented human cases, with 1 fatality. The CDC's emergency response, first enacted in April 2024, provided extra support and resources for public health, including enhanced staffing. But with cases now slower to appear and the CDC pointing to predictable seasonal trends, with spikes usually seen in fall and winter, officials say serious cases are unlikely to go undetected, even if some mild cases slip through the cracks due to shifting federal guidelines. The current consensus, echoed by the Department of Health and Human Services spokesperson, is that the public health risk from H5N1 is low at this moment. Still, they assured that ongoing tracking and rapid escalation plans remain in place should things shift unexpectedly. Here's a bold question for you. Is the CDC striking the perfect balance between caution and normalcy, or is it taking an unnecessary risk by dialing down its emergency posture? Should emergency protocols linger longer as a safeguard, even when all signs point to declining danger? Let's open the floor. Do you agree with the CDC's move, or do you see hidden risks in letting our guard down? Share your perspective below, this one's sure to spark opinions. 3. CDC ends emergency response to H5N1 bird flu in 2025. What you need to know. In a significant development, the Centers for Disease Control and Prevention, CDC, has officially concluded its emergency response to the H5N1 avian influenza. This decision was announced by a representative from the Department of Health and Human Services, HHS, who indicated that the emergency measures were deactivated to transition back to regular program activity last Wednesday. This change comes in light of a noticeable decrease in animal infections and the absence of any reported human cases since February. The spokesperson emphasized that the CDC will maintain its vigilance, stating, surveillance, readiness, and response for influenza, including H5N1 bird flu cases, will continue under the purview of CDC's Influenza Division and other appropriate agency programs. This ongoing commitment ensures that the CDC remains prepared to address any future outbreaks. The emergency response to the H5N1 bird flu was initially activated in April 2024, during which time the CDC documented 70 human cases of the virus. Notably, there has been no evidence of human-to-human transmission. Tragically, one individual succumbed to the illness earlier this year after being hospitalized with a severe form of the disease. CDC officials reported that this individual was a man from Louisiana, who likely contracted the virus from a backyard flock of birds. Currently, the risk posed by H5N1 bird flu is considered manageable. However, the CDC has assured the public that it will continue to monitor the situation closely and scale up activities as needed. Interestingly, over a dozen states have reported cases of H5N1 avian flu, with the majority of these incidents occurring along the West Coast, particularly in Washington and California. This situation raises important questions about public health preparedness and the potential for future outbreaks. Are we doing enough to safeguard against such diseases? What measures should be taken to ensure that we are ready for any resurgence of H5N1 or similar viruses? We invite you to share your thoughts and opinions in the comments below. 4. US bird flu emergency response ends as infections decline. Shocking but true, after months of worry and nationwide disruption, the United States is finally rolling back its emergency response to the bird flu outbreak that once gripped the country. So, what happened and why now? According to sources familiar with the situation, but not officially authorized to comment, the U.S. Centers for Disease Control and Prevention, CDC, recently ended its emergency management status for avian influenza. This decision comes on the heels of a noticeable decline in new infections. Earlier in the year, The contagious virus managed to move from flocks of poultry into herds of cattle and even made dozens of people ill. That led to a ripple effect across the food industry, sending egg prices soaring and prompting some consumers to question the safety of everyday foods. But here's where it gets controversial. Is the outbreak truly under control, or are we letting our guard down too soon? While official emergency measures have now ceased, some public health experts argue that the virus still poses a risk for both animals and humans, given its ongoing presence in livestock populations. And this is the part most people miss. Viruses like bird flu can mutate rapidly, raising new concerns about future outbreaks if vigilance wanes. The CDC's decision marks a significant shift in the national response, signaling confidence that current containment efforts are effective. For many, this is a huge relief, perhaps even a signal to return to normal routines. Yet it's worth remembering that outbreaks like these have a history of recurring in unexpected ways. Should the US have waited longer before ending emergency actions? Or does this move reflect the best use of public health resources? We want to hear your take. Do you support the CDC's decision to end the bird flu emergency, or do you think it's premature? Share your thoughts and join the debate in the comments below.